my name is Wilma Alvarado-Little, Associate Commissioner for the New York State Department of Health, Director, Office of Minority Health and Health Disparities Prevention. I'm going to speak with you about racial and health equity and the intersection of language access, cultural competence from a health literacy perspective. I'll begin by sharing some background information about the Office of Minority Health and Health Disparities Prevention, also known as OMHHDP. This office was established by public health law in 1992 and operationalized in 1994. Our charge includes, but is not limited to, the following responsibilities: promote, support, and conduct research to improve and enhance the health of minority populations, assist medical schools and state agencies to develop comprehensive programs that increase the diversity of the healthcare workforce, promote and support community strategic planning to improve health equity and healthcare services within minority communities. We work with all, as health disparities and health inequity does not recognize boundaries. We work across the department's programs to advance policies and programs and initiatives that promote high quality, accessible, patient-centered, and culturally and linguistically appropriate care for all New Yorkers. We partner with government systems, public and private agencies, and communities to identify and realize opportunities towards eliminating health disparities and achieving health equity. We identify service areas, or say Section 240 minority areas, which are counties or service areas with non-white populations of 40% or more, to facilitate focusing resources to these areas. This brings the discussion to cultural competency, health literacy, language access, and its intersection with addressing racial and health equity during COVID-19. The OMHHDP is just one small piece among the many areas within the department addressing the community's needs and concerns during this healthcare crisis. We support efforts for the migrant community, the nations, and serve as a point of contact for Governor Cuomo's Ask a Question web form, receiving over 20,000 questions at the local, state, national, and international level, with some of the questions in languages other than English. The department's dedicated COVID-19 webpage is constantly being updated and can be translated into languages other than English. The department offers the COVID-19 hotline, where New Yorkers can call about the virus and direct their questions in their preferred language. Executive Order Number 26 mandates the provision of language access services in the top 6 languages for New York State. This has afforded the ability to identify opportunities for the promotion of language access and the inclusion of cultural competency and health literacy. The OMHHDP organized language access services for testing, the USNS Comfort, Javits Center Hospital, and the New York State DOH COVID-19 hotline, to name a few. Due to the pandemic, services had pivoted from utilizing in-person interpreters to remote interpreting. Telephonic and/or video relay interpreting was mainly how providers met the linguistic needs of patients and families. Accessible translated written materials ensured effective and clear communication during this rapidly evolving public health emergency. So, how do we communicate effectively with equity in mind? Information has been shared as culturally relevant and from a health literacy perspective. For example, when responding to questions of equity, will the use of the word disproportionate resonate with the community? It might not. Yet what they want to know is what's going on in their community. And so we need to be sensitive because they may be feeling overwhelmed or getting information from various media resources. Language, verbal or nonverbal, is extremely important. When interacting with communities of color, of limited English proficiency, or who are deaf or hard of hearing, I am mindful to remember that not all communication is verbal, that a gesture may be misinterpreted. Also, let's practice cultural humility as part of the trust-building component in relationships. We can impact a relationship in one sentence. We have experienced the need for clear and effective communication. If not before, and especially now, it is important to convey information in a clear and respectful way in order to avoid inequity in receiving health care. The healthcare system is complex, and this is a situation when the provider and the patient are both English speakers. Let's add a cultural and linguistic component to this exchange under unbelievably stressful conditions. Information that is misinterpreted or misunderstood by those who are depending and trusting us to deliver it clearly will not create nor support a trusting relationship or environment. When we look at policy, we may want to look for what is actually happening in the practice. This is where the disconnect between the policy and the practice presents an opportunity for connection and continuing education. It's great that we have all these resources, but available doesn't always mean accessible. We provide these resources so our communities have a voice in their healthcare so that they can maintain their own safety as well. The inclusion of health literacy in materials and information helps these resonate with the community. We need to continue to have these areas as part of our multi-focused efforts to maintain levels of health equity, promotion, and support, and health disparities elimination. Thank you.